We talk about, as we know locally, this new hospital complex will replace, it's our local hospital really for three communities, St. Catharines, Niagara Lake, and Thorold, but it will have some regional components as well that we don't even have currently in the Niagara area. Could you touch on maybe a bit about those regional components and how they fit in with the new hospital complex?
Okay, the first one is the Walker Family Cancer Center, and I do believe we have a rendering of the chemotherapy bay. And then we have another shot, which is the chemo bay in progress. But why we've been fortunate in Niagara to have cancer care delivered for 25 years here in St. Catharines, it's systemic chemotherapy. We haven't been, our patients have had to go to Hamilton for radiation therapy. Once we're operational, 95% of cancer care will be done in Niagara, which is a great thing for our patients and families, not having to make that trek up to Hamilton or to Toronto. So I don't know whether we've seen the pictures of that, but again, we've had staff and patients actually come through to provide us some information. The other new service coming into the new hospital is long-term mental health. In fact, that's one of, and Gloria will have the details, but it's one of our largest programs in the new hospital because we are combining or consolidating mental health services into the new hospital from Niagara Falls and Welland. We'll still provide outpatient services in Welland and Niagara Falls, and actually in Fort Erie as well. But the main thrust of mental health, long-term and acute, will be at the new St. Catharines Hospital. And the other new exciting service for Niagara is a cardiac catheterization lab. We've been working very closely with Hamilton Health Sciences on that. When we open up, we start off as diagnostic, which is a good thing because we need to learn before we could move into more of the interventional cath lab, where people could have stenting. I'm sure that some people have heard of that, but again, that's in our plans and we're working towards that and closely with Hamilton. And the new St. Catharines Hospital will be the hub for chronic kidney disease. So chronic kidney disease is something that the province adopted many years ago, a hub and spoke model. So the hub will be in St. Catharines. All of the very acute patients will be there, but we will have spokes in Niagara Falls. They'll be getting outpatient hemodialysis. We've just finished the Welland hemodialysis. So that's another new service that's coming into the new building, the hub there.
Very good.
Yeah.
Maybe both of you, we'll start with Gloria, but both of you can touch on how this new complex, as well as the regional services, how do you think it fits in with attracting new doctors and specialists? We've had some challenges. We're actually making a lot of improvements. I think we've got some good news we can share. But and I'll refer even to the McMaster, the DeGroote School, and some things happening at Brock and Niagara College, along with NHS. Some pretty exciting things happening in terms of attracting new doctors who want to set up practice and stay here at St. Catharines, Niagara. Maybe Gloria, can you touch on that first, and then?
Sure, I'd love to. I mean, I think certainly a new building with shiny new equipment is appealing to any clinicians that are looking at starting up a practice or locating in the region. So that will create interest, and we are getting calls from people to come to the area. But I think that over and above that, and you touched on the fact that the medical school is satellite. We had our first series of graduates in this past year, and when they learn here, some of them do tend to stay here. And I think the other part to that is that the students are recognizing a real a well-received education, and I think the quality of teaching from our physicians is quite notable. They're receiving awards for the level and the skill of teaching that they're bringing to these students, and we're requiring a lottery for students to come to the area, and again, I think that just speaks to we don't go around and sort of blow our horn on that, but I think we should. I think it's quite exceptional. So the medical school component is very important. and also the new programs and the partnerships that we've created with Hamilton, both Hamilton Health Sciences and St. Joe's, in recruiting for these specialty areas, cardiac cath, cancer, and mental health, will make sure that we do this in collaboration. It's not a competition between two areas. It's working through a partnership to make sure our patients get the best care possible, whether they happen to receive it in Hamilton or whether they receive it in St. Catharines at the new complex. So I think it's a good story all around. And Anne certainly always mentions that beyond the doctors, it's also looking at the ability to attract nurses and allied health.
Yes. Yeah. Certainly, and I think the only thing to add to what Gloria said, because it isn't the new building that's attracting, it's the infrastructure that we've actually put in place at the NHS to give them a good learning experience. And one of our physician leads says that the best way to recruit staff, and I'm sure you've heard this before, is to give them that good learning experience. And why, for example, in the emergency program, very difficult to recruit nationwide. And we've been really fortunate to get a few that have decided after they've completed their fellowship to come back to St. Catharines because of the physicians that mentored them. So that's an important element.
Now, we've had the two existing sites,
Right.
the old site on Ontario Street and the general site on Queenston. Maybe, Gloria, touch what's going to happen as we move towards a new healthcare complex and the staff moves over, et cetera. What's going to happen to those two sites in the future?
Yeah, it was an important lesson learned from other hospitals that had gone to a greenfield site to make sure that you think carefully and think early about what you're going to do with your existing sites, and not to leave them, sort of dark as you turn the lights out and turn the lights on in the new. So about 4 years ago, just as we were starting the process on the new complex, we began working through the process of disposition of the existing sites. Ontario Street was sold back in 2006, and anybody who drives by there sees that there's some of the townhouses that are up already in the old parking lot. And similarly, there will be residential redevelopment once we vacate the Ontario Street site. And just recently, the St. Catharines General, similarly, and again with a lot of collaboration from the community group that we worked with there in terms of how they would like to see that area revitalized. They gave us a lot of input and a lot of support. And also from the city, again, thank you, to allow that land to be sold and to develop into residential and get a vibrant area going when we leave it in 2012. So we're really pleased with the outcome on both fronts.
Oh, very good. We've recently heard about a large donation to the fundraising campaign that's been ongoing, and maybe just touch on the campaign and the importance of that to this complex as well as to delivering quality health care in St. Catharines, Niagara.
We like hearing about those those donations. I don't know, Anne, if you want to talk about the incredible work of the foundation.
Well, certainly not just the Niagara Health System Foundation, but of course all of our site foundations have worked together on this capital campaign, because our capital campaign, why a fair chunk of the dollars are going to the new St. Catharines Hospital. It's also going to support other programs in all of our other 6 sites that we have with the NHS. So we were very pleased to hear one of the latest donations, which was the casino one, and they've been very supportive, and our urgent care will be named. That was a naming opportunity for the casino as well. So yes, why we've been very successful, the generosity of our community, meaning Niagara, has been great. There's still work to do. So we continue to ask for donations, because I'm sure when we've said this publicly before, all of the equipment that we use for our patients, 100% of that has to come from fundraising. And when we talked about attracting physicians and other healthcare professionals, they expect to come to a hospital, whether it's a new hospital or one of our other sites, that has state-of-the-art equipment, because that's what they want to work in. So year after year, the ask from our staff is greater than what we can generate. So it's a constant challenge, and we constantly go up to our community and ask for their help for that kind of thing.
So we have a $40 million target, and currently we're at $33,598,650.
Wow.
So we have a little ways to go, and the RFPs for the equipment are out and active, and we're hoping to bring in the full scope of equipment that we have on that list, so that it's not only a new building, but it's also equipped with the newest equipment that's out there.
Maybe both of you can just touch, when we say the newest equipment, I know healthcare is changing so rapidly. For those such as yourselves working in the field, what type of equipment will this facility have?
Some of the things that we will have in our operating rooms and our critical care units are these things called articulating arms that support all of the equipment and what physicians and nursing and other staff have to do with our patients. The OR equipment itself is significant in relationship to imaging. I think that's probably one of the biggest areas, wouldn't you say, of innovation, Gloria, is through the whole diagnostic imaging and making sure that nowadays we can see a lot inside a patient without having to open them up, right? Or do a lot without having to have big incisions. So it's those kinds of state-of-the-art equipment that we're purchasing, and even simple things that we call state-of-the-art but mean so much to our patients are the beds we use, or how we even lift the patient, say from a stretcher to a bed or a chair. The design team has done a great job in ensuring that we can do that to maximize the patient comfort during that experience.
And even in the sort of in the high-tech equipment, the focus on the impact on the patient and the health of the patient in terms of lower radiation doses on new equipment that's coming out was a huge evaluation factor for our clinicians. And it's an area where they actually looked at, if it was a premium cost but a better outcome in the long run for our patients, that's what they went for. And again, being mindful of a set budget, but they would rather go without something and have the best experience for the patient that they could get. So I think all around it was quite the experience to watch this procurement process.
Very good. As we sort of wind up the program today, you mentioned November of 2012, but this is this is being built obviously for the community, for the people of St. Catharines, Niagara. And will there be an opportunity for the public at some point to see their new, what I call their new hospital complex?
Yeah, absolutely. I think the first thing that we'll have access to is what Anne referred to as the mock-up site. We took 5 of the most repetitive patient areas and had them built at an off-site location. It's close to the site, but not right on it. And we will get keys to that sort of within the next by the fall, and we'll be able to allow the public to come through and to see some of the rooms and to just get a feel for what's going on inside the building. But the actual access to the building, it's probably going to be another year before we even get controlled groups going through, because as I said, well, you saw from the pictures, there's an awful lot of wiring and a lot of danger signs all over the place on the inside. But we're having people come and participate there. We have staff coming and doing their departmental meetings on the site. Just being there can be pretty exciting.
Yeah, fantastic.
For sure.
Well, listen, thank you to both of you for all of your efforts, for all of your work on our behalf, and we all look forward, the entire community, to the opening of this new healthcare complex. Thanks, Gloria.
Thank you.
And Anne, thanks for joining.
Thank you.
Okay. And thank you for watching Inside St. Catharines.